everyone, this is PLAB 2 NHS team, and today we are going to see Introduction to PLAB 2 OSCE Examination. In this video, we will be discussing about various kinds of stations, how we can categorize them so as to make our revisions easier and our approach in line with the headings that we are going to see. We will also be seeing some common questions that we generally come across from everyone basically who starts preparing for PLAB 2 OSCE examinations. Right, so we have broadly classified the stations into 9 different topics: medicine, surgery, pediatrics, OBGYN, counseling, ethical scenarios, mixed stations, result sharing stations, and Simman stations. Now, we have further subdivided counseling stations into 6 subtopics, mixed and Simman stations into 2 further subtopics. For example, let's first discuss about the counseling station. When we are discussing about the counseling station, the 6 subtopics are as follows: breaking bad news station, result sharing station, demanding patient station, the colleague station, medical error station, and angry patient station. Now, among all of these 6, colleague station and medical error station overlaps somewhere with the ethical proceedings. So although it's counseling, but you have ethical proceedings from the point of view in your mind, and you have to discuss on those aspects as well. Now, when you're talking about demanding patient, it could be demanding of a test, could be demanding of a medication, could be demanding biopsy, could be demanding any reports. Remember, angry patient is one of the most important skills with GMC tests quite often, time to time, and you can always be ready to have at least one angry patient scenario in the OSCE examination. Now, when we are discussing about mixed and Simman station, we are further subdivided into 2 different subtopics. Let's talk about the mixed station first. When you're talking about the mixed station, the first is about history, examination, and management, this point. So when we're discussing about this, it means that it is basically focused on a mannequin-based station. That means when you enter the cubicle, you have to take a brief, focused history, do your examination on the mannequin, which will be kept, and then again further manage the patient. In this scenario, time is of the essence, and we have to make sure before even we enter the station how much time we are allocating for history taking, how much time we have to allocate for the examination of the mannequin, and how much time we are going to allocate for the management. Other kinds of mixed stations are where you have to take history and you have to discuss about the ethical proceedings or the ethical topic. You have to take history and you have to discuss about counseling or ethical proceeding, as I have discussed for the counseling station and the medical error station. Now, when we move on to Simman, we have further subdivided into 2 different aspects. First is the ABCDE plus the management protocol. That means when you enter the cubicle, in this scenario, the patient will be very acutely ill. Okay, so patient will be unwell from the beginning of the station. So you have to immediately start your ABCDE protocol and keep on managing side by side till you reach the end, or after the 6 minutes, maybe you will have to speak to the examiner. The second kind of station in Simman, when it comes, the patient is not very acutely ill. That when you enter the station, the patient is alert, the AVPU score is good, and you start with the airway being patent because the patient will be talking to you. You check the monitor and you see all the vitals are stable. But as you start taking the history, in middle, the patient will desaturate. So the vitals will go wrong. It could go wrong in terms of his heart rate, his ECG, his BP, could be oxygen saturation, anything can desaturate basically. When anything happens, you again start the ABCD protocol and keep on managing the patient, making sure that the patient is alive till the end of the station. Okay, so that is how we have divided Simman station. One, where the patient is acutely ill, you enter the station, you start the ABCD protocol and you manage the patient. The other one is where you talk to the patient, start taking a history, the patient desaturates in terms of its vitals, you manage the patient again within ABCD protocol and continue managing the patient till the end of the station. Now, we will discuss about the ideas. Now, when we are talking about the section called ideas, it could mean a various different ways. For example, you have to have a general idea of all the station, how it should go about, and also you should have this planning in your mind before you enter any station. So that could be ideas as well. When we mean by ideas, it means we are giving you a general idea how all the stations basically have to proceed, except the ethical and the counseling scenarios. Okay, for example, when you're talking about a history-based station, for example, medicine, surgery, pediatrics, OBGYN, and so on, first thing you have to start, the patient will obviously come with a presenting complaint. You elaborate the presenting complaint. You make sure that you are asking the risk factors related to the presenting complaint. Check your differentials, 2 to 3 or at least 4 differentials if you are able to remember in the examination. And in the order of preference, the one which will kill the patient first should be asked first, and then so on. You can categorize, and you can make sure that you are not forgetting any important differential when you're asking the differential question. Next comes the past medical history, the lifestyle of the patient. Social history in some of the stations becomes fairly important, specifically in the counseling and the ethical based scenarios, in breaking bad news scenarios, whether the patient is having any social support, family support at home or not, whether they are financially well or not. So social history is not very important in all the stations, but there are stations where social history is very, very important, and we cannot afford to miss them when we are taking a history. Obviously, when you are done with your history taking, the next step comes your investigation and your examination. You might get a result from the examiner or the simulator or the patient, or you might not get any investigation report or examination report. Mind you, in this particular section of investigation and examination, it is very important to exactly pinpoint what examination and which part of the body you will be examining. You can always say that you will be doing a general physical examination or a head-to-toe examination, but sometimes the examiner, obviously the examiner is not in the cubicle at this moment of time due to COVID, but the simulator or the patient, they might or might not give you, depending upon how they are directed by the GMC. So what happens is, when you are talking about a general physical examination from head to toe, sometimes we think that, okay, it covers the entire part of the body and they should be entitled to give us the reports of the examination. Few of the times it might not happen. So if you are very specific about what particular part of the body you're going to examine, I would say pinpoint that. Additionally, also tell a general physical examination. When you're talking about investigation, it becomes very important that you tell which particular investigation you are going to do. Unless you tell that particular investigation, you might not get the result from the examiner or the patient or the simulator who is there in the cubicle. Once you have got the examination, you have obviously formed your diagnosis or a provisional diagnosis. You disclose the diagnosis to the patient, or if you have not reached a diagnosis, give a differential diagnosis, and then further manage the patient. So whenever you enter the station, before entering the session, you will be having 90 seconds. So in that 90 seconds, these are basically the headlines that should be going in your mind, and 2-3 risk factors, 2-3 differentials should be there in your mind when you enter the station. And once you have done this way, the idea before you enter the station, your history taking becomes very structured, and that will be a boost to your marks in the OSCE scenario. Now, when we're talking about a mannequin, Simman and a teaching stations, remember these days the total number of stations is 16 and the rest stations are 2. That means in 16 stations we have to perform, and 2 stations we have to take rest, calm ourselves so that we can perform the other stations as good as well. So we know that we definitely have 3 different kinds of stations. At least for now, during the COVID period, we are not getting any kinds of examination station. For example, alcoholic foot, diabetic foot, cranial nerve examination, and so on. We are not getting exam because it involves going very close to the patient, and due to COVID we are maintaining social distancing. But so these 3 kinds of stations are very important, which will be in your examination in one way or the other. So I have tried to focus on few of the combinations which you might get in the examination. Now we know that the 5 stations are basically the telephone based station, and 3 stations will be in this combination. The first combination could be either you might get a 2 mannequin station, that means a 2 mixed station and 1 Simman station. The other combination could be you might get a 1 mannequin station, that means a 1 mixed station, 1 teaching station and 1 Simman station. And the other combination could be you might get 2 teaching station and 1 Simman station. So if you see the entire combination, the one thing which is common in all of them is the Simman station. So you definitely have to prepare really well about all the acute scenarios and how you are going to manage them in an FY2 or a junior doctor level, making sure that the patient is alive till the end of the station. And about the mannequin and the teaching, it can vary depending upon what the GMC basically sets on your day. But these are the three kinds of combinations that you might come across when you are thinking in terms of your examination on your day. Now, when you're talking about basically the next topic is what really matters in the examination. Now, obviously we know there are a lot of factors that matters in the examination. It's not only our performance, but it's our peer performance on the same day as well. But the most important thing is to know the task. For example, knowing the task before you enter the station is very important. That means we have to know what is the core of the station. I can give an example. For an infective endocarditis station, we know it's a very popular station. In this OSCE station, what happens is basically the patient is saying that she doesn't want to stop smoking and she wants to go home because the nurses are compelling her to not smoke in the hospital. But your main core of the station is to keep the patient in the hospital so that you can give her IV antibiotics to treat infective endocarditis and not lead it into complication. But if we sway away from the topic and we make this station as a smoking cessation station, we might not pass this OSCE scenario. So we have to understand the core of the station when we read a question. It's very, very vital and very, very important when we are entering the cubicle. Obviously, next is the confidence. The more confident you are, the better you are going to perform. That is one of the reasons why you would have heard from a varieties of tutors and your seniors as well who have passed PLAB 2 that do not think about the previous station when you are in the rest station. So what I would suggest you is to take deep breaths. I know it's easily said than being done when you are already there in the exam scenario. But this is what we need to practice. You need to practice that when you are in the rest station, you take deep breaths. Forget about whatever has happened because you're not going to change them in any way, but you can change what is going to happen in the next few stations that you have left with you. So confidence is very important, but obviously there's a thin line between confidence and overconfidence. We would not ask you to be very confident just because you know the station from outside the cubicle. Do not get relaxed. Always go with an open mind whenever you enter a station. If you know the station, good enough, back yourself up. Keep your mind cool, think that you know the station, but go with a very open mind. The next is obviously the modulation of voice, specifically when you are showing an empathy and a sympathy. Now, obviously when you start practicing, when everyone starts practicing, a lot of people be generally monotonous whenever they are showing a sympathy or an empathy. But modulation of voice is very, very important in order to understand or in order to make the patient understand that you are on the same page, on the same feeling lines as they are feeling. So your modulation of the voice when you're saying sorry or when you're saying I'm really sorry that this has happened to you is very, very important. When you feel for the patient, it's important that you understand that you are there let's imagine that you might be there in the patient's shoes and how are you feeling. When you start doing this, your modulation of voice will start happening. And this becomes very much important when you are trying to calm the patient in an angry station, also in breaking bad news station. So this becomes very of prime importance. Now listening. Active listening, obviously you would have heard active listening is very, very important. Not only just for the cues that the patient might be giving, but also to make sure that when we are answering the patient's questions, we are mainly patient-centered. Sometimes what happens is, we try to think about what will be the next question that I'm going to ask the patient. And while thinking about that, we somehow miss what the patient has told and we do not acknowledge the feelings of the patient. And what do? We generally miss on those cues and we do not show or we forget to show our sympathy or empathy towards the patient. So that makes it non-patient, patient-centered. So we would not ask you to do that. We'll always ask you to try whenever you are practicing, try to make sure that you are not thinking about the next question because you have already formed your ideas that we have discussed before you have started the station. So once you have formed the ideas, you don't need to think about the next station. You know what is the broad classification that you have to ask. And then you simply answer the questions of the patients and go with the flow as the station flows ahead with time. The next is obviously explanation. This is one of the very crucial part of the station where you have to be very short, you have to be very sweet, and you have to be very simple when you are explaining the diagnosis to the patient or when you are answering any questions that the patient has basically asked. Always remember in the explanation section that always think that you are explaining this to a 15-year-old student who is a non-medical student and who is very young. and they are not even related to medicine field, how are you going to explain it to them? Always think in that way and form an answer or form an explanation of every single disease that you come across. Acknowledging the feeling. As I said, it is again very much related to the active listening part. Only when you listen, you will be able to acknowledge. As I said, sometimes when we are thinking about what we are going to ask the next question, what happens is we forget to acknowledge the patient feelings because we are not active listening what the patient is saying. So all of these things becomes very, very important. And the most important point is the entire station will be the concerns of the patient. Sometimes it might happen that when you ask the patient, do you have any concerns or do you have any further concerns for me? The patient might say no. The patient might say no initially, but when you try to dig in, the patient will open up and starts saying you his or her concerns more. So always remember, even if you have asked once and maybe the patient has asked you some concerns and you have already answered, and then you ask, do you have any further concerns for me? And if the patient says no, try to put it in a different way, try to go with a different angle and see if the patient opens up to you or if the patient asks you any further concerns. That might happen. I'm not saying that would happen, but there is a possibility that it can happen. The next topic also is a very common question: what to study and how to make notes. Now, as I said, the ideas that we have discussed in the previous slides, it's very important to form a general outline of the station. So eliciting the presenting complaint, risk factors, 2-3 risk factors, 2-3 differential diagnosis, past medical history, social history, lifestyle, investigation and examination, disclosing the diagnosis and the management of the patient. So this is the basic outline of the station, except the ethical and the counseling station, of course. Now, following the structure while writing your notes, so you follow the same structure that you follow generally. You can use the mnemonic of P3 Maftosa. That's obviously fine, that's not a problem. It's just that sometimes we don't prefer to use P3 Maftosa because you might get confused what is P1, P2, P3 in the examination. But if you are well versed with P3 Maftosa, feel free to use so. There is no problem in that. But whatever structure you follow, make sure to follow the same structure in all history-based station. Now, obviously, this is one of the very important things that do happen when we start making notes. We just keep writing everything. So it's very important that you do not make a book or you do not make a textbook. As I said, outline of the station and the ideas of the station becomes prime importance. Once you know that these are the ideas, this is how I have to write my entire station. I will show an example in a few slides as well, so that it becomes a little clear what I'm trying to say. Making sure that you write the concerns. Now, for example, you would have seen our one-page OSCE stations that we are generally posting on Instagram, on Facebook. So on that, you would be seeing potential patient's concern. So when you write the outline of the station, you just write the outline of the entire idea of the station, but you write in detail about what all concerns the patient might ask. For seeing what concerns additional the patient might ask, you might follow NHS website, nhs.net. That's one of the best websites because that is patient oriented. It's for the patient, and all of the patients basically do access that when they are having any kind of disease. Following the steps in management. Obviously, we know that there are 7 steps in management. A lot of people use it in a very different way. Some say it's Aersons, some say Arisons. Anything is fine. Whatever you use, make sure to use all the 7 steps so that your entire station is very structured. Now, when you suppose if you cannot make notes, all right, if you're not able to make notes, you're short on time, you're pressing on against time, what you can do is you can highlight the important points do you think that you should not miss in a station. For example, in a cancer-based station, of course, you cannot miss a cancer-based scenario. The flaws, mnemonics, you cannot miss them. In a chest pain station, any chest pain station, you have to remember that you have to order an ECG and an enzyme. You cannot miss these 2 points in the investigation. So such things, it's very important to highlight. And when you highlight them in a different color or a different highlighter, you'll make sure that these are the most important point of this station and you cannot afford to miss them. Now I have placed my notes where I will tell you how basically I write and how to go about in a station. For suppose this is a back pain station. Now whatever the question is, we know that the first 5, 7 or maybe 9 question is about Socrates because the presenting complaint is back pain. Then the question comes is about the risk factors, or you can say questions related to the diagnosis. So the questions that you will be asking in back pain is BPH and the prostate and the cancer questions. So that becomes my idea. So that becomes my point. That is my question point. Next comes the general symptoms or the DDX. Okay, next comes the general symptoms or the DDX. Then comes the MFTOSA or past medical history. Then comes CAFE DX, the lifestyle, and then comes investigation and examination, and then the management part. So basically, when I have to now summarize all of them, I will not write each and every point. I will not explore Socrates. I'm not going to explore any BPH or prostate questions because I know what BPH and prostate questions are. I will not going to expand any flaws question because I know what flaws and cancer symptoms questions are. DDX questions, I will just write the DDX, the name of the DDX. I'm not going to expand what questions I'm going to ask in the DDX because that again is going to take time. But if you feel that you will not be able to remember the DDX questions, write the name of the DDX, let's suppose BPH, and write few questions side by side. If you feel that is important for you, do that. This is the example of the outline that I'm trying to tell you. For example, this will be my outline if I write about a back pain. So Socrates, the next question will be anything else. Then I'll be asking about specific questions related to the disease like BPH, prostate, cancer symptoms. Then I'll be asking about the risk factors to see if there is any risk factors. General symptoms and cancer symptoms I will ask. I'll ask the DDX, I'll ask past medical history, I'll ask lifestyle, I'll ask social history if it is relevant, I'll go to the management, and I'll write the concerns. Why I have written in detail in concerns? As I explained, writing concerns in details and thinking how are you going to answer them if the patient asks you. It's always good to presume that the patient might ask such so and so questions. Always try to put yourself in the patient's shoes. Think if you are in the patient's position, what are questions you're going to ask to the doctor. In the same way, prepare your answers. Prepare your answers in the most simple way you can, making sure that you are completely answering the patient's concern. So in this scenario, the concern can be, is it cancer? Or can it be treated, and so on. You write the detailed explanation if you feel so, or if you know that you can answer them, you can skip the explanation as well. Now, should we follow one or more scripts? Which academy should we join, and does it make any difference? Now, as I am basically recording this video, I have got a personal message asking me the exact same question. Doctor, I am confused between this and this academy. What do you think should I join? Now, I will tell you the simple answer to this question. This is a very common question which everybody does go through when in the dilemma stage when you're trying to choose an academy. Now, I would say all academy basically teaches you the same thing. Now, you will wonder if all the academies teach you the same thing, why do people prefer? So, the preference depends upon which academy your friends are going. If you will be able to afford the academy based on its location, maybe it's in London, maybe it's in Manchester, and which academy is closest to your examination center as well, and what you have heard from your seniors or read from different experiences on Facebook or different blog section. All of these basically are a contributing factor to you to choose an academy. But as I said, the bottom line, all academies basically teach you the same thing. Some academies might be better in one thing, and the other academies might be better in the other thing. But if you want to have an academy which will be better in everything, I think that is too much to ask. Okay, I think that is too much to ask. But all the academies, all the tutors, everyone online, whosoever is teaching, they're doing a brilliant job. You choose anyone, stick to them, but you can, if you want, you can refer other academies' notes as well. That's absolutely your choice. So, as I said, in one line, it completely depends on you. See where your friends are going so that you can have your friends while you want to practice. See what's going on with your budget that you have. See if you want to save some money and not be on the expensive side, being in London, and so on. Now, if you have to ask us, we would be trying to tell you that if you want to read about the history-based station, Aspire or Dr. Hamid's notes is one of the best one for the history-based stations. But if you want to discuss about the counseling or the ethical-based scenarios, the result sharing, the breaking bad news, and all such kinds, we would say any one of them are better, any Samson, Swami, or Dr. Hamid's. Since examination stations are not coming these days, but in case from next year, if it starts coming again back to the normal self, then you can follow Dr. Ankur's video on YouTube, you can follow Geeky Medics, and there are many others which I have given already in the blog of PLAB to NHS. You can go there and I have already made a complete set of YouTube videos that you can go and watch. The next question comes, how much time is required for preparation? This is again a very common question that everybody asks. Now remember, before COVID, we had an estimation completely that we were having around 360 to 375 questions, or you can say OSCE stations. But to be really honest, the total number of OSCE stations will be around 210 or maybe 230. But when each of the stations are modified little bit, they become a new station for the candidates, for us as well, and then the total number becomes 350, 370. Right now, what I can estimate, obviously, the total number of stations are more than 450 plus. But on a positive scale, lots of them are tainted version of the old ones. So as I said, the total number of cases will be around now, maybe around 250 to 270. But when you taint few things here and there, they become a new OSCE station. And then the number increases from 260, 270 to 450 plus. Now, to be honest, if you ask us, we would be telling you that the total time required for your preparation would be anywhere between 3 to 4 months. Starting your preparation, because initial preparation will be gathering of all the notes, gathering of all the information from the blogs, from Facebook, from your seniors, from the links that you might have online, all those things with your starting, because initial starting is pretty slow and you take some time to get accustomed to the PLAB 2 OSCE stations, and then you start practicing. So all those things with the 2 weeks or 2 weeks, 15-16 days of the academy time, total I would say around 3 to 4 months is a good amount of time to prepare for this OSCE examination. Now, a very important question, is it really very hard? Now, before I answer this question, it is very important to understand what are the factors that might influence your score in the examination. First is basically your own performance. So your performance obviously has to be at its peak level when you are performing, and you have to do your best when you are there in the station. Second, as I said, your peer performance also influences your score, because we know that GMC basically takes the average of the station and they do the calculation, and hence they come with a passing mark of each station. Hence, your performance also gets influenced by how other people have performed on your day. One very important is to understand is that if there are old stations, which I mean, if the stations or the OSCE scenarios that you know, for example, very common scenarios like MI, pneumonia, pericarditis, okay, back pain, BPH with a UTI, such scenarios, if you make a blunder mistake, or if you are not able to reach a diagnosis in simple stations, others are definitely going to perform really, really well. And because of that, the passing marks will go very high, and even if you score 6 or 7, you might still fail the station. So it's very important to not make a mistake in very common, very simple OSCE scenarios. So these are the 3 most important factors that basically influences your score. Now, the question still stands the same. Is it really very hard? To be honest, it is not really very hard. Okay, to be honest, it's not really hard. But it begets our another question. Is it a test of knowledge? To be honest, I would say yes, a bit yes, but most of it depends on, it tests your nerves, your quick thinking on your feet, and your IPS skills, how you can keep yourself calm in the stations. All the new stations, as I said, it tests a bit of knowledge. For example, let's take a scenario of premature ovarian failure. In that scenario, if you do not remember what exactly are the risk factors, what questions to be asked to understand or reach a diagnosis, you will not be able to obviously reach a diagnosis. Obviously, you will be able to manage the station somehow, but you will be missing on the few important aspects of the station because we are not really aware of the knowledge of the station. How to manage the time in the examination? It's very, very important to manage the time in the examination, because you would have often heard people saying that I was unable to finish the station. But does it really matter that you have to finish the station? In a lot of stations, yes. In a few stations, maybe not. We will see. You need to read the question and understand what the task is. As I said, you have to understand the core of the station, and you do not have to get in fixed with something else that comes up in the station while discussing with the patient. The example that I've given with infective endocarditis is a very common example. Next is planning and analyzing. How you're going to plan. So the ideas that we discussed in the beginning of the video, you have to plan and analyze the entire station in those particular ideas or those basically particular points. Once you analyze them, you know it in your head what you have to go and how you have to go. A proper structure is formed in your brain. The next point is a combined station, because obviously a combined station is one of the most difficult station for the time management, at least, because in this station you have to not only take a history and the management but also perform an examination on the mannequin. So you have to distribute maybe 2.5 minutes for your history taking, 2.5 minutes for your examination and mannequin, and maybe 3 minutes for your management. You have to give your good amount of time for management as well. And remember, as I said, planning is everything in a combined based station. Teaching, ethical, and a counseling station. As I said, there are few stations where finishing the station is not important. Why? Because in a counseling and ethical stations, you cannot all the time finish the station. They have maybe 8 to 10 concerns, and maybe you cannot answer all the 8 to 10 concerns in the 8 minutes of the time that we have been provided. So in such scenarios, it is important that you should be answering the patient's question, which is the main core of the station, but it doesn't really matter. You don't really have to rush just because you want to finish the station. That doesn't mean that you cannot finish the station. Definitely you can finish a lot of counseling, ethical, and a teaching station. But if you think that you are rushing with time just in order to finish the station, we would advise you not to do so. Till you are answering the patient's concern, the patient is happy with whatever you are answering, you are good to go. Now, what happens is, as I said, the disadvantage of not listening properly to the patient, and active listening is not there if in the station, you will sway away from the task and no one is going to prompt you. Why? Because post-COVID, the examiner is not in the station. You must have heard this, or you would have seen the GMC video as well on YouTube, I guess. That if you are swaying away from the topic, the examiner might ask you to reread the task. But post-COVID, since the examiner is not in the cubicle, no one is there to prompt you or tell you to read the task again. But you might get one prompt or one chance from the simulator who might try to put you in the right direction. But if we miss that, we will be swaying away from the actual task. And as I said, analyzing the core of the station will give us enough time to prioritize what thing has to be done in the station and what thing can be left towards the end of the station. The next most important question is, should we practice with one partner or multiple partners? Now, we have written a very detailed blog on this topic. So initially you should definitely start with one partner till you reach around 70-80% of your entire course, and then start practicing with as many multiple partners as possible. What are the benefits? Tremendous benefits. I'll give you an example. When you're practicing with one of your friends for a pretty long time, whatever inputs you get from your friend, you keep correcting them and you become better, and you might become flawless from whatever inputs they have given you. But when you start practicing with a third person, they still will have another input which you still need to get yourself better. In that aspect, what happens is, when you are practicing with one patient, there will be an optimum point after which your friend might not be able to tell you or might not be able to point out your flaws in the role play. And that is the time when you should understand that you should be going and practicing and start practicing with other candidates or your other friends so that you can get as many inputs as possible. What is the disadvantage? There is no disadvantage. When you're practicing with people from different academies, you also understand how they are performing and what are their ideas and how are their methods of proceeding for a particular station. So take opportunities and advantage of all the free stations. So there are many tutors online. Aspire does free sessions. Dr. Hamid does free sessions. Dr. Asiya, Dr. Mo. There are numerous online tutors who does free sessions all the time. Take the opportunities and never miss them, because you're definitely going to learn one or the other thing from each session. Definitely have a practice partner. It's very, very important to have a practice partners. With a personal experience, I can tell that if you don't have a practice partner, it becomes a little difficult for you to go on with your practice sessions, and towards the end of the examination, it becomes quite difficult. So now, what examiners are basically looking in the examination. So as we have discussed, we'll just try to highlight few points over here. The confidence, obviously very important. Able to keep the patients alive in an emergency situation, for example in the Simman acute based station. You need to have the knowledge and the awareness of various ethical aspects. So all the ethical scenarios and the counseling scenarios where both the ethical guidelines and the counseling is required. For example, the mother coming and asking about their child being given a contraceptive. IPS, definitely IPS, and ITS. So interpersonal skills are one of the very important things that the examiners are basically looking in the candidates. The next is how you will be able to handle an angry station, a patient who is blaming you for a misconduct, a demanding patient station, and if you are able to handle a request. These kinds of basically stations are one of the very important stations for the GMC, where they try to assess the skill of the doctors all the time. The next is if you are able to address your own mistake and rectify it. For example, if you somehow, if you have a slip of the tongue in the examination and if you say something which you didn't mean, or if that makes the patient gets offended, make sure to apologize really well and go on ahead with the station. Don't keep on apologizing. You apologize once, understand your mistake, rectify it, move on. If you are able to answer patient concern, obviously this is, as I said, concerns. It's one of the most important part of the entire examination. And active listening skills is very important, because if you are listening actively, you will be acknowledging the patient's concern, you will be showing empathy, you will be showing sympathy, and you're not gonna miss anything else. And you will be very much patient-centered and patient-focused. The next is what extra basically can you do? So for example, we have written a good blog on our website. You can go there and have a look from the very beginning, and also check the GMC website for different kinds of procedures that you are expected as a junior doctor to perform. Now, there are various procedures which might not be given in any academy notes, and that might still feature in your examination because that is plainly and bluntly written on the GMC website. We have highlighted those points in our blog as well. You can go either of the places and have a look. Make sure to read them really well. Not only, don't think if it's not in the notes of any academies it might not come. It can still come because the GMC has already written it out on their website. You can also go through the sample scenarios of the GMC to understand what kind of stations they might give and what are basically they are looking into. And go through the ethical page of GMC. It's very, very important. Why I would say all the new ethical scenarios that you might be coming across, all of those ethical scenarios are being added every single day into the GMC's ethical page of the website. There you can not only follow the guidelines but also can answer questions in a role play method. So we will be providing you a link in the description. You definitely should go and have a check in the GMC website. That is all, guys, we have discussed. So this was a brief introduction about PLAB 2, what you can do, what academies to choose, how you should be practicing, how not you should be practicing, what are the main focus of PLAB 2 scenarios, and what exactly the examiners are looking in the candidates. Any detailed questions that you guys have, you can obviously ask us in here on the YouTube page, or you can go to our Facebook page. That is one of the fastest way of getting an answer, or you can DM any one of us so that you can receive your answers well. In case if you want, we will be putting down the link below for the GMC website and the ethical scenario so that you can go and have a look there. Additionally, we will also be giving links to our blogs so that you can also read in very detail about all of these aspects, what time, the GMC bell, both of us we have given. We have also made a 7-minute GMC bell in case if you want to practice with a 7-minute GMC bell as well. So that is all, guys. I hope you guys have got a great idea about how a PLAB 2 scenarios and what is expected of you in the OSCE station. Stay safe, happy new year, hope 2021 is not like 2020, and see you next time for another video. Thank you.